This wasn't a street drug. It was prescribed. It didn't come from dealers. It came from doctors, and it didn't destroy lives by accident. In the late 1990s, a pharmaceutical company released a painkiller that would help trigger the deadliest drug crisis in modern American history. Its name was OxyContin. The company behind it promised something impossible. They told doctors it was safe. They told regulators it wasn't addictive. They told patients it would give relief, not dependency. Behind closed doors, they knew the truth. This drug delivered massive doses of opioids directly into the bloodstream. The high was real. The addiction was fast. Within weeks, patients weren't asking for pain relief anymore. They were asking for more pills. Over the next 2 decades, hundreds of thousands of people would die from opioid overdoses. Families would collapse. Entire towns would disappear. And the company that sold it wouldn't just survive, it would become one of the richest pharmaceutical empires in the world. Before OxyContin, doctors were trained to fear opioids. They were addictive. They destroyed lives. So Purdue Pharma didn't just sell a drug. They sold a new idea. They claimed addiction was rare, less than 1%. That number came from a short letter, not a real clinical trial. Purdue knew it wasn't solid science. They used it anyway. Sales teams were trained to repeat one phrase: pseudo-addiction. If patients wanted more pills, it wasn't dependency. It meant their pain was being undertreated. Doctors were encouraged to increase the dose. Higher dose meant stronger effect. Stronger effect meant faster addiction. Purdue tracked the data in real time. They saw which regions were consuming more, which doctors were prescribing more. Instead of slowing down, they pushed harder. And behind it all, the company was controlled by one family, the Sackler family, a family that would soon make billions by redefining addiction itself. Purdue didn't market OxyContin to everyone. They were selective. They focused on places with hard labor, high injury rates, and limited access to alternatives. Mining towns, factory towns, rural America. Sales reps were told to identify high-potential doctors, not the most careful ones, the most generous prescribers. Doctors who questioned addiction risks were ignored. Doctors who wrote large prescriptions were rewarded. Bonuses, trips, recognition. Some physicians were prescribing thousands of pills a month. Entire communities became saturated. When pills ran out, withdrawal began. Patients didn't turn back to doctors. They turned to the street. Heroin was cheaper, stronger, easier to get. What started as a prescription ended as an epidemic. Purdue saw the numbers. They saw overdoses rising, and they kept expanding. By the early 2000s, alarms were impossible to ignore. Overdoses were rising. Addiction clinics were filling up. Doctors were reporting loss of control. Federal regulators started asking questions. The FDA reviewed OxyContin's claims. So did the Department of Justice. Purdue's response wasn't to pull the drug. It was to manage the risk. They hired former regulators, former prosecutors, former FDA officials, people who knew exactly how the system worked. Warnings were softened. Labels were adjusted, but not corrected. The word addictive stayed vague. The sales pitch stayed aggressive. In 2007, Purdue pleaded guilty to misleading doctors and the public. They paid a fine. No executives went to prison. The drug stayed on the market. For Purdue, the message was clear. Lying was expensive, but not illegal enough to stop. After the 2007 guilty plea, Purdue didn't slow down. They adapted. The fine wasn't a warning. It was a calculation. Executives studied what went wrong, not to change the behavior, but to avoid the next lawsuit. The message stayed the same, just quieter. Doctors were still pushed to prescribe. Doses were still increased. Internally, Purdue tracked one thing above all else: revenue per patient. As long as patients stayed alive, they were profitable. When addiction turned fatal, the numbers moved on. New patients replaced the dead ones. Entire states were now dependent on opioid prescriptions. Local pharmacies couldn't keep up. Pill counts exploded. Purdue didn't call it a crisis. They called it growth. By the time the death toll exploded, Purdue already had a defense. They separated themselves from the bodies. Overdose deaths weren't their fault. They blamed doctors. They blamed patients. They blamed abuse. Internally, the data told a different story. Purdue tracked overdose reports by region. They knew exactly where people were dying. Those regions weren't shut down. They were reassigned. Sales reps were quietly redirected to nearby towns. Same doctors, same playbook. When reporters asked about deaths, the company avoided numbers. They talked about misuse, about bad actors, about responsibility, never about volume, never about dosage, never about the fact that OxyContin pills were being crushed, injected, and snorted because of how powerful they were. Purdue didn't deny the deaths. They buried them in language. And while the public argued over blame, the money kept moving. The collapse didn't start in Washington. It started in the states. Attorneys general began comparing notes. Different towns, same pattern, exploding prescriptions, rising deaths, the same drug at the center. West Virginia moved first, then Ohio, then dozens more. States accused Purdue of flooding communities with pills they knew were dangerous. Internal sales maps were subpoenaed, emails were pulled, training manuals surfaced. They showed targets, quotas, and a strategy built around saturation. Purdue didn't deny the documents. They attacked the lawsuits. They delayed hearings. They buried courts in motions. They forced states to spend years fighting. Every month of delay meant billions more in revenue. While cases stalled, the crisis deepened. Overdose deaths crossed new records. And Purdue realized something terrifying. This wasn't one lawsuit anymore. It was the beginning of a national reckoning. When the lawsuits became overwhelming, Purdue made a move no one expected. They didn't fight the cases. They killed the company. In 2019, Purdue Pharma filed for bankruptcy, not because they were broke, but because it was the fastest way to stop the lawsuits. Bankruptcy froze the courts. It paused trials. It blocked victims from suing individually. Thousands of families were suddenly silenced. Behind the scenes, Purdue's owners, the Sackler family, were already preparing their exit. Billions of dollars were moved out of the company before the filing. Offshore accounts, private trusts, legal shields. The company collapsed on paper. The money didn't. Purdue offered a deal, a settlement in exchange for immunity, no trials, no admissions of guilt, no prison time. For the Sacklers, bankruptcy wasn't failure. It was the escape plan. The deal Purdue proposed shocked even the courts. The Sackler family would pay billions. In return, they would receive something priceless: legal immunity, not just for the company, for themselves. No criminal charges, no civil liability, no testimony under oath. Families who lost children would never face them in court. Judges were told this was the only way to get money to victims. No deal meant no compensation. The Sacklers didn't admit wrongdoing. They called the crisis complex. They called the deaths tragic, but never criminal. In exchange for the settlement, their name would be removed from Purdue. Buildings would be renamed, records sealed. The public would get money. The family would walk free. For many victims, it felt like this. Lives were negotiable. Justice was optional. And the richest people in the room set the price. The settlement was supposed to end the story. It did the opposite. Victims didn't feel relief. They felt erased. Families spoke out. Judges questioned the deal. States pushed back. Some courts refused to approve it. They asked a simple question: how can a company cause mass death and leave without criminal trials? The outrage spread beyond the courtroom. Universities removed the Sackler name. Museums rejected donations. Institutions cut ties. The family tried to disappear quietly, but the documents stayed public. Emails, training manuals, sales strategies. They showed intent, they showed awareness, and they showed that the crisis wasn't an accident of medicine. It was engineered. The legal system had closed one door, public judgment opened another, and this time the damage couldn't be paid away. Just when it seemed settled, the case took another turn. In 2023, the U.S. Supreme Court stepped in. They didn't review the opioid crisis. They reviewed the immunity. One question changed everything. Can a bankruptcy deal protect individuals who never declared bankruptcy themselves? The Sacklers had used Purdue's collapse as a shield. The court wasn't convinced. If the deal was overturned, the family could face lawsuits again. Criminal exposure, civil trials, public testimony. States prepared for a second round. Victims hoped for something they'd never had before: a courtroom, not a settlement, not a negotiation, but sworn testimony under oath. For the first time, the escape plan looked fragile, and the people who built it might finally have to answer. Even as Purdue collapsed, the opioid crisis didn't slow down. It evolved. As OxyContin prescriptions fell, new opioids filled the gap. Cheaper, stronger, deadlier. Fentanyl flooded the market. What began with legal pills ended with synthetic drugs that killed in minutes. The supply chain had changed, but the addiction pipeline remained. Patients had already been hooked. Communities were already broken. By the time regulators reacted, the damage was permanent. The crisis that Purdue helped ignite had outgrown its creator. Deaths continued to rise. Entire generations were affected. The company was gone. The system it built was not. By the early 2020s, the truth was no longer disputed. Government reports confirmed what families already knew. Prescription opioids had killed hundreds of thousands of Americans. OxyContin was a central driver. Federal agencies admitted the crisis was fueled by corporate deception, not misuse, not ignorance, deception. Yet even with this acknowledgement, the legal outcome didn't change. Purdue accepted responsibility. On paper. The Sacklers did not. They never testified under oath, never faced criminal charges, never sat in front of the families. The system chose resolution over reckoning. Money over answers, closure over accountability. For the victims, the message was clear. The truth was finally spoken, but it still wasn't punished. Here's what the numbers actually say. OxyContin generated over $35 billion in revenue. That money came from pain, from addiction, from repeat prescriptions. As overdose deaths climbed, profits followed. The Sackler family personally withdrew more than $10 billion from Purdue before bankruptcy. Not after, before. When settlements were finally discussed, the proposed compensation was a fraction of what had been taken. Billions earned, billions removed, billions protected. The fines Purdue paid were smaller than annual profits at the peak of the crisis. To the system, this wasn't mass death. It was a balance sheet, a calculation where human lives were a cost of doing business. And the math worked. This story wasn't about a bad drug. It was about a system that rewarded damage and punished nothing. Doctors were misled, patients were addicted, communities were destroyed. And when the bodies became impossible to ignore, the system didn't ask who was responsible. It asked how much it would cost. The answer wasn't prison. It wasn't accountability. It wasn't justice. It was a settlement. Money moved. Names were erased. And the people who built the crisis walked away. Purdue Pharma collapsed. The Sacklers didn't. Because in this system, harm isn't a failure. It's a risk. And as long as the profit is higher than the punishment, the next crisis is already being designed.